Hi guys, we are going to study the part 1 of the mammary gland. So let's get into the topic. First of all, what is mammary gland? As you can see in the picture, a mammary gland is an exocrine gland that produces milk in humans and other mammals. As we all know, mammals are vertebrate animals characterized with the presence of milk producing mammary glands for feeding their young ones. For example, humans, cows, kangaroos, sheep, goat, chimpanzee, dogs, whales, etc. As you can see here, mammals in Latin, mama means breast. If you see in the diagram, group of mammary glands plus associated connective tissue plus skin collectively forms breast. So mammary glands are grouped collectively forms the breast. So mammary glands are component of breast. So as you can see here, the mammary gland located in the breast is the most important structure present in the pectoral region. A mammary gland is a modified sweat gland, that is apocrine type of gland. It is a defining characteristic of mammals, with its primary function being to produce milk to nourish offsprings. The mammary gland forms an important accessory organ of the female reproductive system and provide nutrition to the newborn in the form of milk. Now we'll discuss about anatomy of mammary gland. This is very important in terms of anatomy subject. Shape of the mammary gland is hemispherical or conical or piriform or pendulous or flat. There can be many shapes depending upon the individual or the stage at the mammary gland present, like during the pregnancy or the adolescent age, like that. So it can be various shape. Coming to the sex, the glandular tissue is found in both sexes, that is females and males, but is rudimentary in males. It is more functional, more developed in females, and except in the condition called gynecomastia, like where the male has the breast. And when it comes to the location or situation of the breast lies in the superficial fascia of pectoral region. In the superficial fascia, you have to remember this. It is divided into 4 quadrants, that is upper medial, upper lateral, lower medial and lower lateral. You can see in the picture right over there. So 4 quadrants it's divided. A small extension of the upper lateral quadrant called the axillary tail of Spence passes through an opening in the deep fascia and lies in the axilla. So the opening is called foramen of Langer. Now if we discuss the extent, that is base is circular and the breast is vertically from second rib to the sixth rib and horizontally from the lateral border of the sternum to the mid axillary line. You can see in the picture. Now the relations, the deep structures of the breast from superficial to deep if we take. So you can see the retromammary space beneath the breast and pectoral fascia enclosing the pectoralis major muscle, and serratus anterior and external oblique muscle also has in the relations. So you can see in the picture. So if you want to describe the relations, the breast lies on the deep fascia, that is pectoral fascia covering the pectoralis muscle. Still deeper there are parts of 3 muscles, namely the pectoralis major, the serratus anterior and the external oblique muscle of the abdomen. You can remember this with a mnemonic like RSPF. We know that BSF, body secretary force, like that. RSPF major SAO. So you can remember by this mnemonic from superficial to deep. And note here is the breast is separated from the pectoral fascia by loose areolar tissue called retromammary space. Because of the presence of this loose tissue, normal breast can be moved freely over the pectoralis major muscle. See this diagram. This diagram will make you understand in detail, like from superficial to deep, the relations with the breast. So you can see the muscles in orderly that we have remembered through the mnemonic. You can see here the retromammary space, pectoral fascia, pectoralis major muscle. You can see serratus anterior, external oblique muscles, and the rib cage behind that. So you can see here. So see in this diagram the muscles deep to the breast, pectoralis major, serratus anterior, external oblique muscles. Over that the breast you can clearly see here. In the part 2, that is next video, we'll discuss about the structure of the breast. Stay tuned.